Now we're going to move on to our data part. You have the infographic that was sent out with that email, and we also did make a copy of it in the packet at your tables. I would like to introduce Dr. Laurel Davis, who is going to be highlighting some of those findings. And here's Laurel.
Thank you, Julie, for the introduction, and thank you to all of you for being here today. I know that you've taken several hours out on a busy morning at a busy time of year to be here to talk about this very important issue, and I appreciate your attendance. I'm excited to be able to share with you today some recent findings from the Minnesota Student Survey that hopefully will give some context to the sorts of mental health concerns that children of incarcerated parents in the state of Minnesota are facing. Before I get started, I just want to emphasize, as I try to do anytime I'm giving a presentation that's based on data, that and many of you who work with these families and children already know this, that the children of incarcerated parents are a very diverse group, and that as we're presenting data, it's important to remember that what we're talking about here are group averages, and that we know that these youth have a variety of experiences leading up to parental incarceration, during incarceration, and after parental incarceration. And so just because we can identify that incarceration is associated with certain increased risk, that certainly does not imply that all children who have incarcerated parents are going to develop certain kinds of disorders. So let's get started. I'll start by telling you just a little bit about the Minnesota Student Survey. I imagine that many people in the room know quite a bit about the Minnesota Student Survey, particularly if you have children in the state of Minnesota that are in middle or high school. It is a statewide survey that is administered every 3 years. The last time it was given was 2013, and it will be given again this coming spring. In 2013, there were a couple of large school districts that decided not to participate, Minneapolis and Rochester amongst them. However, the survey was completed at more than 450 schools across the state and completed by more than 160,000 students. So it is an excellent snapshot of the health and well-being of young people in the state of Minnesota. It is given to all students in 5th, 8th, 9th, and 11th grade. Although it's important that you know that the question about parental incarceration was not asked to the 5th graders. That was decided to be too sensitive for students of that age. So as we go through and talk about these findings, we're only going to be able to report on students in 8th, 9th, and 11th grades. The survey asked a variety of questions of young people, including things like their background, their family, what their families look like, their school, health and health risk indicators, out-of-school behaviors, and other sorts of behaviors that might act as either risk or protective factors. So it really is an excellent index of the overall well-being of young people in our state. One of the goals of the Strengthening Families Affected by Incarceration Collaborative is to try to identify different data sources that are already existing that can help us learn more about the lives of children of incarcerated parents. And so as part of that initiative, the collaborative lobbied and worked to get a question about incarceration added to the Minnesota Student Survey. And 2013 was the very first time that that question was on the survey. So we're very excited to be able to examine incarceration and its relationships with all the other data that's on the survey. So here's what that question looked like. The question reads, have any of your parents or guardians ever been in jail or prison? And students are encouraged to mark all that apply. So the one option is no, none of my parents or guardians have ever been in prison. Or yes, I have a parent or guardian in prison, jail or prison right now. Or yes, I have a parent or guardian or jail in prison in the past. So we can use this question to create 3 mutually exclusive groups: children with no experience of incarceration, children with some experience in the past, and children who have a parent who's currently incarcerated. There are a small number of children who answered yes to both the current and the past question. We don't know whether that means one parent was incarcerated in the past and is incarcerated now, or perhaps it's 2 different parents who were in the past and incarcerated now. But in any case, we put those children into the current group. So children who answered yes to both questions are, for our purposes, going to be categorized today as currents. Let me tell you a little bit about the demographics of the young people that we're talking about. And here specifically, these are the demographics of the 112,000 students who answered the question about parental incarceration. So when we're looking at all the students who gave us data about that question, here's what they look like. The gender is pretty evenly split. It's just about half and half, males and females. The average age is just under 15 years old. About 30% of the students were experiencing poverty, and by that we mean that they answered yes to one of three questions. A recent experience of food insecurity, not being able to get enough food, a recent experience of family homelessness, or receiving free or reduced lunch at school. So answering yes to any one of those questions, we considered some experience with poverty. About 9% of the students had some sort of individualized education plan in place. And in terms of race and ethnicity, the majority of the students were white, and that reflects the population of Minnesota as a whole. But you can also see that we do have a fair number of racial and ethnic minority young people as well. So here's what it looks like in terms of parental incarceration. So this graphic will give you a sense of what the proportions are in the three different groups. So most of the samples said that they had never had an experience of parental incarceration, but there were 14% of the young people who reported incarceration in the past, and just about 2% who were currently experiencing a parental incarceration. And these colors, this orange, green, and blue, are going to be used throughout the rest of the presentation to signify these different groups. So collectively, if we look at this together, that implies that when we're talking about students in middle and high school, that 1 out of every 6 young people in the state of Minnesota has a parent either currently or formerly incarcerated. That is an enormous number of children. And considering how large that number is, we really don't do enough to talk about this issue and to bring it forward. And so that's one of the reasons that I'm so glad that you can all be here today, so that we can have this great conversation. Also, I want to say that in a previous infographic, we described the disparities in these young people according to race and ethnicity. So we know, of course, that there are significant disparities in terms of who gets involved in the criminal justice system. And so therefore, there are also disparities in the race and ethnicity of young people who are involved in the criminal justice system, or whose parents are incarcerated. And we covered that in a previous forum, so I won't go into that today, but that data is available if you're interested in it. All right, so now I'm going to switch over to talking about what we actually found. And the first thing that I want to tell you is that all of these results are split by gender. And that's because we know that there are some very common mental health problems that are more prevalent in females than males. So for each one of these outcomes that we're looking at today, I'm going to describe the results for males and females separately. So the first one we'll look at is internalizing. Internalizing is a name for a group of disorders that are characterized by people looking inward. So things like anxiety, depression, somatic complaints, those are internalizing disorders. The Minnesota Student Survey has 5 items that act as a short screener for internalizing problems. And it's been well established that people who answer yes to 3 of the 5 items are at elevated risk for having a diagnosable internalizing disorder. So in this graphic, when we're saying internalizing, that's what we mean, that students answered yes to 3 of the 5 questions. The questions are things like feeling depressed, feeling anxious, trapped, having trouble sleeping, things like that. So you can see that both children with currently incarcerated parents and children with formerly incarcerated parents report these internalizing problems at much higher rates than other students. So for example, if we look at children with currently incarcerated parents, males are about 2.8 times as likely to report problems, and females are about 2 times as likely to report problems. The next outcome that we'll look at is purposeful self-injury. And here we're talking about whether the student has done anything on purpose to injure themselves in the last 12 months. So things like cutting, burning, etc. So what we're looking at here is any student who said that they had done that at least 1 time. And you can see the pattern is pretty similar to what you saw before. So again, we see considerably higher rates of these problems in both males and females for both currently and formerly incarcerated parents. All right, the next outcome is suicidal ideation. So thinking about or fantasizing about wanting, seriously wanting to attempt suicide. So we're looking at here at any student who said that they had tried to do that, whether recently or in the past. So I hope I'm not going to give it all away by just saying that the graphics are going to look the same as we go through the different outcomes. There's a really consistent pattern here that emerges, and so. If you are thinking to yourself, hey, that looks really similar to the slide before, you're absolutely right. Across these outcomes that we looked at, we really consistently see this pattern of elevated risk. So here, for example, dealing just with currently incarcerated parents, males are about 3.5 times as likely to say that they have thought about attempting suicide, and females are about 2.8 times as likely. All right, the next outcome is suicide attempt. So here we're asking students whether they actually have made a serious attempt on their own life. These figures, I think, are some of the most striking and the most troubling, given the really serious consequences associated with suicide attempt. So again, we see a similar pattern where both students who have a formerly incarcerated parent and a currently incarcerated parent report increased odds of having attempted suicide. And here, for example, males with a currently incarcerated parent are more than 10 times as likely as males who have no experience of parental incarceration to say that they have actually tried to commit suicide. Now, this next outcome is diagnosis of a long-term mental, emotional, or behavioral problem. And so now this is a little bit different because now we're not talking simply about what the actual symptoms are, but whether or not a student has been identified as at need or potentially having some sort of concern. So the question is, do you have any long-term mental, emotional, or behavioral problems? And long-term in this case means lasting 6 months or more. So again, consistent pattern, both children of currently incarcerated parents and formerly incarcerated parents endorse this item at much higher rates. Okay, this is the last outcome we'll look at, and this is treatment for mental health problems. So the question is about whether you've ever received any kind of treatment for a mental health concern. And again, a consistent pattern. So if we're talking about children with currently incarcerated parents, males are about 3.5 times as likely, and females are just under 3 times as likely to say that they've received some sort of treatment for a mental health concern. So when we take all these findings together, what are the conclusions that we can make? So there do seem to be higher rates of serious mental health concerns across all of the outcomes that we looked at. Those findings are very consistent. That's important because we know that people that have mental health problems that onset in early life often have poorer outcomes across a variety of domains. So it's not simply that people who have early onset mental health problems are likely to continue to have mental health problems. Those mental health problems are also likely to affect their functioning in all sorts of other arenas, so things like academic achievement. And when we think about the ways that things like mental health problems and poor academic achievement are related to incarceration, this is a very important link in terms of the intergenerational cycles of incarceration that we see. We also see that these results are true for both current and past incarceration. So it's not the case that children are only symptomatic while their parents are incarcerated. We see these results in many of these children. Their parents were incarcerated quite some time ago, and they are still at elevated risk for these problems. We, of course, also see higher rates for males than for females. There are several limitations that we should talk about. So for one thing, given the nature of this data, we don't know which parent was incarcerated, so we can't say whether it's a mom or a dad, and that could be important in some cases. We don't know how long ago the parent was incarcerated, so children who said that they had a formerly incarcerated parent, that incarceration could have been last month, or it could have been 10 years ago, and we can't tell the difference. We don't know how long a parent was incarcerated for, so we don't have any way to distinguish, for example, between a student who has a parent who was incarcerated for a very long amount of time versus a parent who had a very short jail stay. We don't know if parents were in jail or prison, and that is important because there are some very different contexts that are associated with jails and prisons, and that's something that could affect children's coping. We don't know what the parent's role was in the life of the child before they were incarcerated. So in many cases, we don't know if these are custodial caregivers that we're talking about. Some of these children might have said, yes, I know that my dad is in prison, and I know that because I've never had a relationship with him, because he's never been a part of my life. He's been in prison as long as I can remember, right? Also, although this is an enormous sample, so we have a lot of confidence in these results, it's also important to point out that some school districts weren't included, and particularly not having some large urban districts could affect our results. And then finally, I want us to think about as we move into the next phase of our day, which is the panel discussion. We're going to hear from a variety of speakers who have interesting perspectives on this topic. And I'd like to encourage you, I've given you some information about what students report that they're actually experiencing. And for the rest of our time today, I'd like to really encourage you to think about what are the mechanisms that put young people at elevated risk. So we, through this data, can demonstrate that children of both currently and formerly incarcerated parents are at elevated risk for a variety of mental health problems. We heard a great talk this morning by Dr. Boss about ambiguous loss, which certainly is one of the potential mechanisms by which this risk is transmitted. And I'd like to just encourage you to think about what the other potential mechanisms are out there that seem to create these risks for these young people. Thank you.